Good afternoon, everyone. Thank you for joining us today for Developing Competencies on Non-Clinically Licensed Patient Navigators. My name is Shira Morales, and I'm the Project Manager for Healthcare Professional Education at the GW Cancer Institute. Before we get started, I would like to take a few minutes to go over some housekeeping remarks. We ask that everyone keep their phones on mute to avoid any background noise and disruption during the program. And also, please note that today's program is being recorded. We will use a question and answer feature for this webinar. You will see the Q&A box at the bottom right hand of your screen. If at any time during the presentation you have a question, please type it in and we will address it during the Q&A portion at the end of the webinar. The questions are anonymous and I will repeat the question. We will take questions at the end of the presentation, but feel free to write questions in the Q&A box as we go, and we will make sure to answer them in the time allotted at the end of the webinar. We will also use the chat box feature, which is on the top right side of your screen. You can use the chat box to interact with each other. Because we will be talking during the presentation, we probably won't be able to keep up with the chat. So if you want to ask a question, just make sure you use the question and answer box at the bottom right. And as a note, before we get started, we will send out a PDF of the slides and a link to the archived webinar to all of our webinar participants. The recording will also be archived on our website along with any previous webinars. I'm going to take a quick moment to review today's agenda. I will provide a brief overview of the Center for the Advancement of Cancer Survivorship Navigation and Policy. Mandy Pratt-Chapman will be joining us and will provide a presentation on developing competencies for non-clinically licensed patient navigators. We will conclude the webinar with a participant Q&A, and we will do so through, again, the Q&A feature at the bottom right of your screen. So I wanted to provide a brief overview of the Center for the Advancement of Cancer Survivorship Navigation and Policy, which brings you today's webinar. The Center for the Advancement of Cancer Survivorship Navigation and Policy, which we affectionately call CA-SNAP, was created in 2009 through a generous grant from the Pfizer Global Health Partnerships Program. The mission of the center is to advance cancer survivorship and patient navigation efforts locally and nationally through education and training, policy analysis, outreach, and research. The center offers survivorship and navigation resources that are available online at our website and through a monthly e-newsletter. Additional materials is sent through our CA-SNAP listserv to over 2,300 subscribers. We write white papers, create case studies, and work cooperatively with other healthcare organizations to advance patient-centered care. We also share summaries of meetings and roundtables that we've hosted to catalyze patient navigation, cancer survivorship, and patient-centered care initiatives. Through our CA-SNAP, we've offered several trainings. We were recently awarded funding from the Centers for Disease Control and Prevention that will help us translate our existing in-person trainings to an online format to make them available at no charge for participants. We will start with our executive training on navigation and survivorship, which is really the nuts and bolts training for building and sustaining navigation and survivorship programs. We will also be developing a competency-based navigator training that will be available through our online academy. Today's webinar is part of CA-SNAP's monthly webinar series, which launched in April 2013. We feature a variety of topics related to navigation and survivorship based on feedback from healthcare professionals across the country. We also have several research initiatives that we provide updates on through CA-SNAP. You can find these archived webinars and the results on our website, along with reports that accompany them. Our goal is to really share the findings so that we can provide you with the information to help you provide patient-centered care. If there are any topics that you would like to know more about, please let us know. Our email is listed on the screen at casnp@gwu.edu. Now here are some more information about our CA-SNAP resources. You can visit our website to see webinars and reports. We also encourage you to check out our free Cancer Survivorship e-learning series for primary care providers at the link on the screen. That's cancersurvivorshipcentereducation.org. We have a lot of oncology professionals complete it and really find it useful. We recently launched a new module on prostate cancer survivorship care guidelines. We also recently launched a new website for comprehensive cancer control programs. The site really includes a resource repository where users can search for and access comprehensive cancer control resources produced not only by the GW Cancer Institute, but also by state comprehensive cancer control programs and their partners, cancer control coalitions, and other stakeholders. You can access this new website at www.cancercontroltap.org. Our next webinar will take place on November 19th from noon to 1. We hope you join us. Following this webinar, you will receive an email with a recording and today's slide. We also have a new feature where you will be automatically redirected to an evaluation survey to provide feedback on today's webinar at the conclusion of the presentation. I would like to introduce our guest speaker today, Mandy Pratt-Chapman. Mandy Pratt-Chapman is Director of the George Washington University Cancer Institute, known as GWCI, responsible for strategically planning and implementing prevention, community health, patient navigation, and survivorship programs, as well as overall fiscal management and development for the Institute. She is Principal Investigator for the Centers for Disease Control funded cooperative agreement providing technical support to comprehensive cancer control programs across the country. She is the Senior Director for GWCI's Center for the Advancement of Cancer Survivorship, Navigation, and Policy, which is CA-SNAP, which is our nationally recognized training center building capacity and setting national standards for patient-centered programs. She is the co-principal investigator for the PCORI-funded study evaluating cancer survivorship care models in collaboration with Livestrong, the Commission on Cancer, the American Cancer Society, and the Cancer Support Community. As principal investigator for the GWCI Avon Safety Net program and the DC Citywide Patient Navigation Network, she oversees a safety net that has helped over 7,000 individuals access care in the District of Columbia. She is also GWCI Project Director for the National Cancer Survivorship Resource Center, which is a collaboration with the American Cancer Society and Centers for Disease Control and Prevention. The Survivorship Center aims to reduce health inequities and improve health outcomes for cancer survivors at a national level. Ms. Pratt-Chapman works with clinicians, researchers, and advocacy stakeholders to improve access and delivery of care to cancer patients and survivors. Thank you so much, Mandy, and welcome.
Thank you, Shira. I appreciate that. Thank you. So I'm really excited today to share with you a project that we have been working on over the last 18 to 20 months, developing competencies for non-clinically licensed patient navigators. And my talk today is going to cover the importance of competencies in the health professions, a process of developing consensus-based competencies for patient navigators, and then some training resources for navigators to develop those competencies. So there's the number of patient navigation programs, as we all know, is rapidly increasing, but there is high variability among navigators and navigation programs. The field lacks role clarity, and institutions are struggling to ramp up their programs with new Commission on Cancer accreditation standards at a time when resources are increasingly limited. In 2013, the GW Cancer Institute conducted a national web-based survey of healthcare professionals at institutions with patient navigation or clinical survivorship programs. Respondents were asked to identify patient navigation caseload, measures tracked, tracking tools, clinical tools, funding, challenges, and recommendations for financial sustainability. 100 respondents completed the survey. Some of the challenges identified are shown here, but I'm only going to focus on the lack of role clarity and standardization. A more comprehensive overview of the best practices study was provided by Ann Willis on an archived webinar called Best Practices in Navigation and Survivorship Survey Results webinar, and that's available on our website. We had 73 people respond to the question, what are the greatest challenges that patient navigators face? We did not stratify based on type of navigator, but generally you can see that funding and role clarity are the greatest challenges that were identified. Overall, there is role confusion within patient navigation. People are confused about the roles of community health workers versus patient navigators versus nurse or social work credentialed navigators, and there are also health educators, quote, lay navigators, which may or may not be paid, volunteers, and family members who are providing navigation services. So there's no consistent terminology for patient navigators. Navigators are sometimes doing administrative work, which may be an underutilization of their role, and was demonstrated in the patient navigation research study to detract from real core navigation duties that eliminate barriers to care. Navigators are also doing duties that potentially clinicians should be doing, which comes with legal risk for the navigator and the institution. There's no consistent job description, and there's focus on different parts of the continuum. So it's been difficult to create common measures, and there haven't been any established competencies. So why do we need to develop competencies? Competencies help create professional standards. They provide a framework for training, and they clarify function and importance to stakeholders such as grantors, institutions, payers, or policymakers. In our best practices survey, we found that only 1% of programs were successful in getting navigation services reimbursed. Most programs are funded on grants or through operational budgets. Regardless of funding source, it's critical for a navigator to be able to describe what they do and why it is of value. At the GW Cancer Institute, we're taking a multi-pronged approach to supporting navigation sustainability. In July of this year, we spearheaded and submitted a highly collaborative request to the U.S. Bureau of Labor and Statistics to consider the creation of a standard occupation classification code for patient navigators. This would help to create a common language to describe what navigators do and why they are different from community health workers, social workers, nurses, and health educators. Our new online executive training on navigation and survivorship that will be available in just a few weeks will help program leaders plan, implement, evaluate, and sustain their navigation programs. Finally, we wanted to help set standards for the navigation field by developing the first ever consensus-based competencies. This work took about 18 months and was a mix of qualitative and quantitative research. The end result will be a free online training that will be available this fall to support navigators in their professional development. By better explaining what a navigator does, who he or she does it for, in what setting, and how, we have a better shot at helping programs either obtain institutional funding or reimbursement for services down the line. Now I'm going to walk you through how we developed the competencies. In 2010, we launched a knowledge-based patient navigation training with support from the Pfizer Global Health Partnerships program. The goal of the program was to educate non-clinically licensed navigators, who are sometimes referred to as lay navigators, although these individuals are professionally employed. We also trained several new nurse navigators. The 2.5-day in-person training, delivered initially with contributions from the Colorado Navigation Training Program, covers a variety of topics that you see here, including roles and responsibilities, cultural competency, end of life, barriers and resolutions, health reform, and clinical trials. While these topics are very important and our evaluation demonstrated that people are learning, we wanted to make sure that what we were teaching was aligned with what is most important for navigators to know and practice. Ultimately, we wanted to create a competency-based training. There's been a paradigm shift in health education from structure or process-based education to competency-based education. This means a movement from knowledge acquisition to knowledge application with a focus on improving one's ability. We've done a great deal of work over the last 2 years to transition a topics and knowledge-based training to a competency-driven training, and I'll walk you through what we've done so far. Because efforts to establish competencies are already underway for community health workers and nurse and social work navigators, we wanted to focus on oncology patient navigators who are not clinically licensed. The first phase of the project was to identify roles and responsibilities of oncology patient navigators. We published a framework of functional domains in December 2013 describing the results of this phase of the project. This shows the steps in our process. First, we conducted a literature review and internet review. We looked at existing curricula from various health profession competencies that were related to navigation and navigation training programs. We had expert consensus around the functional framework, and then we conducted a focus group with patient navigators. And I'll walk through the next 2 steps as I go along. So these were the groups that were partnering with us on our steering committee as we built our functional framework. The Academy of Oncology Nurse and Patient Navigators, the Oncology Nursing Society, the National Association of Social Workers, the Association of Oncology Social Workers, the Association of Community Cancer Centers, and patient navigators and community health workers around the country. For the Lit Review stage, we reviewed training curricula of navigation programs, journal articles that described roles and responsibilities of community health workers, patient navigators, and nurse or social work credentialed navigators, as well as community health worker competencies. First, we mapped all of the themes we found in the literature into a huge matrix. With a team of researchers, we moved around bullets and collapsed domains. In the end, we had these 12 functional domains that emerged from the literature. So we had a lot of domains and a whole list of different tasks, activities, competencies, and duties that a navigator might do. Our next step was to identify the common basic role across navigator types and identify the high-level differences between them. So this is a comparison of the previous slide that I showed you in terms of curriculum that we were providing in our in-person navigation training. And here you can see that about 50% of what is represented was previously included in that training. But by systematically working through a consensus process, 50% of the priority topics actually changed, and those are the items that are highlighted. Here's an example of one functional domain that we developed. Again, our focus was really on this middle column of the oncology patient navigator. We did this for each of the 12 functional domains to show the similarities in the far left column and the distinguishing roles in the right 3 columns. So here you can see that identifying and addressing barriers to care and reducing health disparities as defined by age, disability, education, ethnicity, gender, sexual identification, geographic location, income, or race that often bear the greater burden of disease than the general population is a goal that's shared between community health workers, patient navigators, and clinical navigators. But community health workers might address barriers to accessing the healthcare system itself, while a patient navigator might address structural, cultural, social, or emotional barriers to care once someone was in the system or entering the system, and a clinical navigator might provide services to at-risk populations, which might be defined by high need, high acuity, or high volume at the institutional level. Here's another example of another domain that we mapped, patient empowerment. Identifying problems and resources to help patients solve problems and be part of the decision-making process can be shared among community health workers, patient navigators, and clinical navigators. But a community health worker might motivate an individual and a community to make positive changes in their health behaviors, while a patient navigator might identify specific barriers in participating in decision-making. And a clinical navigator might help the patient actually make decisions for their care based on different treatment options. Following the development of the framework, the GW Cancer Institute conducted focus groups with navigators around the country. The goal of the focus groups was to validate the framework and identify any gaps prior to developing competency statements. This gives you a snapshot of some of the demographics of those who participated in the focus groups. We held 6 focus groups with 21 navigators. Most of them were female. Most of them were between the ages of 55 and 64. Most were white and Latino and held a bachelor's or master's degree. They had various years of experience, worked in multiple settings, and were geographically diverse. Focus group participants were non-clinically licensed and currently performing the duties of a patient navigator. Participants were invited to take part in a 90-minute virtual focus group by conference call. Focus group moderators asked questions from a focus group guide developed in advance. The focus groups were semi-structured, so if participants went off topic, the moderator probed for opinions and themes relevant to the discussion before moving back to the focus group guide. Participants were asked to identify the most important functions of patient navigators prior to referencing the published framework. Participants were then shown the functional domain framework and asked which of the functions were most important and whether there were any gaps in the framework in terms of critical functions of a non-clinically licensed navigator. Then participants were asked to identify roles, responsibilities, knowledge, skills, and abilities needed for a patient navigator for each functional area. Finally, participants were asked for their suggestions in the areas of content and format for the planned competency-driven training. The data was coded by 2 research assistants using In Vivo 10 software, and there were 13 major themes or parent nodes identified in the focus groups. These themes are represented here on the slide. Child and grandchild nodes were detailed with greater granularity within these parent nodes. We then looked at existing frameworks for competency development and existing nurse navigator competencies. In 2013, the American Association of Medical Colleges, or AAMC, sought to develop a common framework for medical and other health professional education, so we looked at that framework. AAMC recognized that despite the movement toward competency-based education, no common taxonomy exists for competency domains. Therefore, they reviewed existing competency frameworks to develop a taxonomy that included domains of competency for any healthcare profession and extracted a common set of competencies specifically for physicians. We also wanted to learn from our colleagues at the Oncology Nursing Society, who had just released nurse navigator competencies. Both the AAMC framework and the ONS nurse navigator competencies were released in 2013 after we conducted our initial literature review and functional domain mapping. This was a lesson learned that was shared by AAMC. Shared language is important in leading adaptive change. When people begin to use the same words with the same meaning, they communicate more effectively, minimize misunderstandings, and gain the sense of being on the same page, even while grappling with significant differences on the issues. AAMC reviewed existing competency frameworks and identified these 8 domains that you see here on the left, and these were in common across all health professions. They based these final domains on 6 ACGME domains, which stands for the American Council of Graduate Medical Education, plus 2 others that emerged from the literature review, and the 2 supplemental domains were interprofessional collaboration and personal and professional development. We mapped our original functional domains across this framework, which helped us identify potential gaps in our functional framework. Primarily, these gaps involved competencies that might be shared across various roles within healthcare settings. We ended up with the 8 AAMC domains, each with an overarching competency, and 72 total competency statements. We then vetted these with a national steering committee, and we asked members of the committee whether the competency was clear, non-clinical, in the correct domain, and whether they supported the competency statement for non-clinically licensed navigators. This slide shows the number of competencies in each domain in the original list of competencies that we developed. After expert review from our steering committee, the process resulted in us eliminating 7 competencies for a total of 65 competency statements. From July 14, 2014 to August 11, 2014, we rolled out a national survey, which included the vetted 65 competency statements. So this was a survey that was in the field for about a month. We had 618 people consent to participate, and 525 worked within the field of patient navigation and therefore were eligible to actually participate in the full survey. We had varied responses for each of the questions, but at least 200 people answered each of the questions. Overall, we had 80% endorsement for all statements, or over 80% endorsement for all statements, with most over 90%. The lowest endorsement for any one competency was 83%, and many competencies had nearly 100% endorsement. These were the questions that we asked on the survey. We asked whether the competency was an essential function, whether it was clearly written for consistent interpretation for implementation, whether the individual taking the survey endorsed the statement as a competency for non-clinically licensed navigators, and then we asked for qualitative feedback in a free text box that people could submit with their comments. This shows the breakdown of respondents. For respondents who answered the demographic questions, there were about a third of respondents who indicated they were nurse navigators. About a quarter of respondents indicated they were non-clinically licensed navigators, and about 8% said they were social workers. About 16% indicated that they were a navigation supervisor, and all of the other categories were significantly less than 8%. We stratified results across respondent categories based on patient navigator, nurse or nurse navigator, social worker, community health worker, health educator, administrator, supervisor, trainer, research, or other. We then looked for the lowest endorsements within specific respondent categories. We looked for variation of endorsements across respondent types and looked at the qualitative data to find out where we could improve. This led to our final set of competencies. The result was 45 competencies over 8 AAMC-endorsed health profession competency domains. I'm now going to show you an example of a few of the competencies. So here's an example of a competency in the patient care domain. The overarching competency is to facilitate patient-centered care that is compassionate, appropriate, and effective for the treatment of cancer and the promotion of health. The specific competency statement is assist patients in accessing cancer care and navigating healthcare systems, assess barriers to care, and engage patients and families in creating potential solutions to financial, practical, and social challenges. This is an example of a competency that was highly endorsed, but that we refined with qualitative feedback from the survey. Another example is this competency in the domain of knowledge for practice. The overarching competency is to demonstrate basic understanding of cancer healthcare systems and how patients access care and services across the cancer continuum to support and assist patients. The specific competency is to demonstrate basic knowledge of medical and cancer terminology and refer medical questions to clinicians. Here's a third and final example of one of our competency statements. This comes from the domain of practice-based learning and improvement. The overarching competency is to improve patient navigation processes through continual self-evaluation and quality improvement to promote and advance the profession. The specific competency is to use evaluation data such as barriers to care, patient encounters, resource provision, population health disparities data, or other quality indicators to collaboratively improve navigation process and participate in quality improvement. Once the competencies were validated, we wanted to build a training that would be freely available online, and this training will be available this fall. We're actively working on the training now, and our goal is for this training to help standardize what non-clinically licensed navigators know to ensure greater consistency in the profession. And the training work is specifically funded through a cooperative agreement from the CDC. The training will be approximately 40 hours of self-paced learning. It's based on adult learning theory, so it's interactive, multimodal, and includes a pre-post evaluation, as well as supplemental resources for learning. In the year ahead, we will also develop a toolkit to help states leverage our online training. It will provide tips for technical assistance to Navigator networks, such as how to create networks and strategies to engage members. The toolkit will also include information about working at the state level to advance the field of patient navigation. If there's specific information that you would like included or considered for inclusion in the patient navigation toolkit, please contact us so that we consider that as we start to develop this toolkit. I also wanted to provide you with these 3 articles that the team here at the GW Cancer Institute has written and published if you want to learn more about some of our work. Finally, I want to acknowledge the Pfizer Global Health Partnerships Program, who funded our original live trainings, the Avon Foundation, who partially supported the development of the framework and competencies by paying for participant incentives in the focus groups, and the CDC for providing the staff support to develop this online training. I also wanted to acknowledge our steering committee, which helped us create our original functional domain, and also took a look at our original set of competencies. We also reviewed the original draft of competencies with the following competency reviewers who are involved in the navigation work at a national level. Finally, I want to acknowledge the members of my team who participated on this project throughout the last year and a half. And at this point, I am happy to take any questions that you have. And so we'll open this up for questions. We have one question in queue right now, which asks, when will slides be available? These are great. And we're going to provide those slides for the presentation to everyone after the call. Any other questions? Oh, will a nurse be allowed to take the course as well? Absolutely. We decided not to provide continuing education credit for this course, since non-clinically licensed navigators are not, they don't need CE hours. However, if you're interested in the content and you are a nurse, you absolutely can take the course. Currently, we're not offering CE credit for it, however. Are there any other questions? I see that some people are typing. How soon will the course be available? We're aiming for October or early November for launch. We're currently developing, we have it all mapped out, and we're currently developing the course right now, but it should be available within the next couple of months. What advice for getting reimbursement in the state? That's a great question. And I am going to, for full disclosure, tell you that I may not be the perfect person to answer this question. I think that there's some potential in the new CMS language around providing options for states to expand reimbursement for non-licensed providers under the supervision of a licensed provider for some navigators who work more on the community health worker end of things or in the prevention space. And my understanding, I just found out a few days ago that CMS issued some language in oncology bundled payment proposal that's up for public comment, I believe. It's not official, it's kind of out there for public comment, that also involved reference to navigation, but I haven't had time to actually review that language or know whether that will be helpful to the field. I think we have a couple of options in terms of reimbursement. There's direct kind of fee-for-service reimbursement, and that would involve coming up with a billing code. The work that we did in terms of the standard occupational code may be a step in that direction, although that's not the intention of that project. It's really to help classify and provide a concrete definition of the job role. But certainly without being able to describe the role, we couldn't move toward a billable service. I think it might be more likely and more sustainable and provide better access to care for those who need it if it's bundled with other oncology services. And for those on the non-clinical end who are based in the community, potentially working through the billing on the Medicaid side in terms of state options if your state actually meets the qualifications to go there. So that's kind of a complicated and not full answer to that question. Will the training be available in Spanish for promotores? Not currently. We are currently developing this in Spanish, but we do have some strong partners in that space, and it's something that we could consider in the future. It's not something that was currently on our planning schedule, but we can talk about it as a team and see what options might exist. I think that there are other programs for promotores as well, but I appreciate that question. Approximately how long do you estimate it will take to complete the course? Right now I'm estimating about 40 hours, which is similar to what community health workers need to do in some states for certification. There's certainly a range. It's self-paced, so you should be able to come back to the content and work on it as you wish to. And you also could do portions of the training if you only want content in a certain part of the training. However, there will be certain things that you need to complete in order to obtain the certificate of completion for the course. Is there cultural competency that covers First Nations people in the training? That's a great question. We are working on the cultural competency piece right now. I don't think that the training will be comprehensive in terms of covering First Nations people. It will be something that we mention as important, but there's certainly room for more technical assistance and other kinds of resources that we might be able to develop in partnership with others for that goal. So it's something that's on our radar, but I would not look to this training as something that's an in-depth course on that topic. But I also appreciate the question. Let's see. I have a lot of questions. Will the certificate be offered after completion? Yes, there will be a certificate. This is not certification. It's a certificate saying you completed a course, and it will indicate what course you completed and number of hours of completion. And we are working potentially on partnering with the Academy for Oncology Nurse and Patient Navigators, who are looking long-term at potential certification of navigators, but we are in discussion with them right now. That time would probably be after 2016. Let's see. I missed the slide where you stated how long the training will be. About 40 hours. Could you, sorry, the questions are moving. Could you please talk a little bit about the training cost certificates? There are no costs associated with the training. We'll push it out through our newsletter, through our listserv. You can freely access it. You won't have to pay anything to access the training. A certificate will be issued that I'm looking at Anne right now. I assume will be able to be printed, so there won't be any costs associated with that. So we wanted to make this content as broadly accessible as possible at no cost to you. Any plans to broaden training to other areas of navigation besides cancer? That's a great question. I think there's a lot of room to provide training in patient navigation, and I think a lot of the content that we're providing will be helpful for those outside of oncology, but we really wanted to keep a cancer focus on this training and don't currently have any plans to move beyond cancer since that's the core of our mission. I do think there's potential to partner with other organizations that could leverage parts of the training and develop content specific to other disease areas. Will the training include financial resources? We will include resources for different pieces of the training and point navigators in the direction of where they might find additional financial resources. So I think for all of the competencies, it will be, it'll touch on many, many things that a navigator should know, but it may not be really in-depth on any particular topic. Aside from the pre-post training evaluation, will you be developing other evaluation tools to measure the effectiveness of these competencies or standardizing roles? That's a great question. We actually are finalizing an evaluation plan for our overall project currently, and we can give some thought to how we might do that. We certainly always welcome feedback and would love to hear from you if you see things that we could do better or the gaps that still exist. But in terms of more longitudinal evaluation, I think that that's something that we need. We still need to think through, and it's not currently on our plan. I've heard there's a nurse navigator certification, not just certificate of completion, in the works. Is there a lay patient navigator certification? So the Academy of Oncology Nurse and Patient Navigators is in the process of developing a nurse navigator certification. Their plan is to launch that in the fall of 2016 at their annual conference. And my understanding is that a non-clinically licensed navigator certification may follow. They're interested in starting with nurse navigation since that's where their core contingent started from, but they're working with us on patient navigator certification, and we're in discussion right now about the possibilities of that. Would this presentation be available after the webinar? Absolutely. We will send out the slides after the webinar. You can connect with me at a later date to establish contacts for First Nations. Thank you very much, Audrey. Is there a way to have the slides? Yes, we will send them out. And how will knowledge gain be assessed as learners take the course? We have a couple different ways of measuring knowledge. We'll do a pre-survey to look at some baseline knowledge, and then we'll do a post-survey to see what knowledge change there was after the course. We also have some built-in case studies and things to make sure that the understanding of application of the content is there, and will provide, for example, an opportunity to answer questions and then see whether what you've responded to is correct and review that content. Okay, I think I got through, oh, there's someone else typing. I think I got through most of the questions. I believe someone else is typing right now, so I'm just going to wait a minute. I'm going to wait just a minute to make sure anybody has their question answered. And for anything that I've indicated that we might do in partnership or we might do in the future, if you have a specific interest, do contact us so that we know if you do have needs or resources to help us partner with, kind of the smartest, best positioned people to advance the field and do some more in-depth technical assistance on those topics. And you're welcome. We got a bunch of thank yous, and I thank you for calling in and for your attention. it's always exciting to see the field growing. Let's see. In addition to the course, what other learning opportunities are available to programs outside of the U.S.? Well, we have regular webinars, as you know, and so those are certainly available. We have a new resource repository that has a lot of different information. It's not just on patient-centered topics, but also comprehensive cancer control topics. So you can certainly look at those materials, some of which have been produced by us and by many other excellent practitioners in the field and researchers. So certainly access that, and if there's other learning needs that you have, let us know. And if there's something that we can do, we'll do it, and if we can't, we'll let you know. All right, let's see. How will we know when the course is available? We will definitely let you know through our newsletter. We'll let you know through our listserv. And sign up for the listserv if you haven't already, which is but you can contact us at casmp@gwu.edu. Also, you can follow us on our new Twitter page. If you follow us on GW Cancer Institute on Twitter, then you can follow what we're doing there, and I'm sure we will push it out there as well. Let's see. Is there any way to share our model of patient navigation program from San Jose? Syed, if you would like to contact us, then Monique House, who's our point person for our navigation training, can talk to you about your program, and you guys can discuss potential options there. Let's see. We have a few more thank yous, and one more person is typing. Just give them a minute. So while I'm waiting for this person to finish typing, I do want to remind you that we will be launching our executive training program. This is a program that we developed in 2009 to really walk through the nuts and bolts of developing a patient-centered program. And we had some really successful cohorts of participants who came back and really loved the program. Some of them came back to present their work and show the success that they did. I was really thrilled that one of our trainees just received an award. I was able to personally present her with an award for her survivorship program at the Academy of Oncology Nurse and Patient Navigator meeting just last week. That was really fun to see her program grow and actually be identified as a best practice program. So this online training is really taking what we've learned over the last 4 years, putting it online, making it responsive to adult learning, and making it, again, more broadly available for all of you, again, at no cost. So that should be coming out really soon. Shira, who introduced the webinar, is working hard on that now. And we hope to have that out in early October. So you can also find out about that through the same dissemination methods from our Twitter account if you follow us, our newsletter, our listserv. So please look out for that too. Great. Is there any way to have contact with the rest of the attendees? Oh, well, that's a great question. If there's a specific question you have, we could certainly send it out on our listserv. It's not, it's a listserv that's driven by us. So we could push something out. If there's a particular question you have and we know of someone you can connect with, then we can also try to make that connection. But we don't have permission from the list to just disseminate everyone's contact information. So one more person is typing. Thank you for your engagement and all of your questions. It's exciting to see. Got 2 people typing, so just give me a minute. Like they may have stopped. So, hold on 1 second. Did you expect having a training on how to evaluate patient navigation programs? That's an excellent question. We're actually very interested in this space, and we're going to be doing some more work in the year ahead on evaluating patient navigation programs. And it's also, yes, foundational aspects of evaluation for navigation is most definitely in our executive training that will be coming out very soon. I think that is. Oh, let's see, one more question. Could I put my email address right now if somebody has a question about AACI's model. Yes, absolutely. So Syed Ahmed is interested in connecting with other people who are on this call. Syed, go ahead and post your email address. If anyone has a question about AACI's model, you can contact Syed directly. He's going to provide that to you now. And so with that, I think that those are all the questions that we have. I'll wait just a second more to make sure that everyone had their questions answered. But this is a pretty exciting process for us. I have a really great team here. It's been definitely a team effort, and we're excited about bringing this to all of you very soon. So, okay, so Syed has posted his email address. If anybody is interested in that model, then please go ahead and contact him. And with that, I will give you back your day. Thank you so much for your attention. I think we have a few wrap-up slides.
Yep. Thank you so much, Mandy, for sharing your expertise on this topic, and to our participants for joining us today. It's very exciting to see that people are excited and engaged on the topic. I wanted to just kind of remind everyone of our resources. So here's some more information about our CA SNAP resources. You can visit our website, again, to see the webinars and the reports. We also encourage you to check out our free Cancer Survivorship e-learning series for primary care providers, and there's a link provided on the screen, and that's, again, cancersurvivorshipcentereducation.org. We would like to remind you to visit our new website at www.cancercontroltap.org, and to follow us on Twitter at GWCancerINST, Cancer Institute. You can search for us. Our next webinar is going to be taking place on November 19th from noon to 1. So please look for registration pages through these portals. And again, following this webinar, you're going to receive an email with the recording and the slides. And you will be automatically redirected to an evaluation survey so that you can provide us feedback on today's webinar at the conclusion of this presentation. Again, thank you, Mandy. Thank you to everyone who's joined us, and we hope everyone has a wonderful day.